Thanks, Gail, and thanks, Nora. So my name's David Bartlett. I am an immunologist, and for the last 14 or so years, I've been really interested in how exercise can be used to modify the immune system of people with different diseases. And for the last 7 years, I've been based in North Carolina at Duke Cancer Institute and the Duke Molecular Physiology Institute as part of Duke University. But we got tired of the hot weather, and so we decided that it was probably best to come back home and do our research back in the UK where the weather's much nicer. So today I'm going to talk to you guys about physical activity, exercise, and nutritional guidance for CLL. And I'm sure you'll all appreciate that there really isn't very much that we actually know. We have a lot of ideas, but we really couldn't say for certain whether some of these things work. So I've got some learning outcomes for this webinar, and at the end of the talk, you should be able to understand the general and cancer recommendations for diet and physical activity. And then I'm going to discuss with you why there are no hematological malignancy specific recommendations. And then we're going to look at a little bit of some of the research that I've recently completed, and we'll assess the effects of higher physical fitness on some of the biology involved in CLL. And then I recently completed a pilot study in using an exercise intervention, and so I'm going to present you with some of the results from that because they're quite interesting. And then I'm going to finish off by talking about our studies that we're going to open up here in Surrey and some advice as to where you can go and what you can do. So I don't have to preach to the choir when we talk about the benefits of physical activity, exercise, and diet. We all know that these factors are good for us. There's no doubt about it. And the guidelines that I was lucky enough to be part of, actually, for the US physical activity guidelines, really came along in 2018 and said, any kind of physical activity is better than nothing. And so even the low intensity physical activity, so as long as you're not sitting on your couch and you're just getting up and walking around, you have some sort of benefit from it. And on this figure, what you can see is up the left-hand side is your hazard ratio of mortality. Now, you could argue with me that everybody has a mortality risk because we're all going to die eventually. But those people who do nothing, if we assign them as the highest risk of premature mortality, what we see is about a 30% improvement or reduction in your mortality risk when you start getting up at about 150 minutes of moderate intensity exercise. And we actually had that 150 to 300 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise. But as you can see from this curve, even doing something low intensity, like walking around, reduces your risk of premature mortality. And what about eating correctly? Well, there's a lot of evidence now that suggests that your correct balance of nutrients and your caloric intake really does improve your health span. Whether it improves your lifespan, we're not quite so sure yet, but for sure it will improve your health span. And if you haven't seen this study, this is quite old now, but these macaws were about 26 years old, and they were bred in captivity their whole life. And the ones on the left were fed just a regular diet, their normal diet, their correct caloric intake. And the ones on the right had about a 30% reduction in their calorie intake. And you can quite clearly see that the monkey on the right has a better fur, better muscular physique, even better eyes. It generally just looks a younger monkey. But a lot of people take caloric restriction as something difficult to do because it may involve reducing your calories by quite a lot, but it shouldn't induce malnutrition. So there's a lot to think about with calorie restriction. But at the end of the day, one of the key things is that the correct balance of nutrients is probably contributing more to this than the reduction in calories as well. So what are the guidelines for adults? Well, they're actually quite standardized across the whole world. And so this is the UK physical activity guidelines. And you can see that it's at least 150 minutes of moderate or a combination of at least 75 minutes of vigorous. There's no plateau, but we still talk about up to 300 minutes. And importantly, there's this 2 days a week of building your strength. So doing some sort of resistance work, whether that be just walking around with heavy bags of shopping or doing some press ups in your house, whatever it is. And then the other part of it is to minimize this sedentary time down the bottom. And then as you get older, we've really introduced this improving your balance component, because as you know, as you get older, your risk of falls is much higher. And so we want to kind of cut that risk out. And so balance training can really help. What should your plate look like? And before I left to go to America, I remember this plate being percentages, and it was something like 60% of your meal should be fruit and vegetables, and 60% should be whole grain foods that are not white bread, and then low percentage of fats and so on. But now it's more about weight. And so I'm sure we all know this, and I saw the answers that came back from the questionnaire at the beginning. It looks like the majority of people think that they eat a healthy diet. But this is for the general population. So what does it actually look like for the cancer populations? Well, we have a few recommendations out there. This is the 2018 World Cancer Research Fund recommendations for survivors, and as you know, CLL is technically classed as a cancer survivor group. But this is the World Cancer Research Fund, and they're based heavily on what the American Institute of Cancer Research does as well. But you can quite clearly see that it's all based on breast cancer and not really other cancers. And so the evidence is actually quite limited for what the WCRF would suggest you can do, even though there's quite intriguing results to suggest being more physically active will decrease your risk. Being more physically active during therapy should benefit you in the long run, should reduce fatigue and should improve quality of life. Eating the correct diet should reduce your risk of secondary cancers. But it's very heavily based on breast cancer or prostate cancer and colon cancer. And so in 2019, the American College of Sports Medicine developed a roundtable to discuss what they thought the recommendations for exercise and health-related outcomes should be in cancer. And they actually came up with a really nice infographic that would suggest, if you start exercising at aerobic intensities, you get these kind of benefits where you have improved fitness, improved health. If you do some resistance, then you get these benefits. And there's less evidence for effects on sleep and so on. But quite clearly what you can see here is again, this is all bladder, breast, colon, endometrial, esophageal, kidney, and stomach cancers. So what happened to hematologic malignancies? And that was a question that we've been pondering for a few years now. But if we look back in the literature, we can actually find some reasons as to why that is. And so back in 2002, this study by James Sirhan and his group showed that there was no relationship or no increased risk of CLL with low physical activity levels or higher BMI. And then the systematic review that came out just a couple of years back confirmed that there was no risk of hematologic malignancies with low physical activity levels or higher BMI. So completely the opposite of what you see in these solid tumors, which are driven by obesity and driven by physical inactivity to some extent. And so, it kind of made us realize, well, this is probably one of the reasons why we don't know so much. And then Nips and colleagues have produced their second Cochrane review. And so for those of you who don't know a Cochrane review, it's one of the most intense and fully complete done reviews of the literature about a specific topic. And in this one, it was aerobic physical exercise for adult patients with heme malignancies. And again, Nips came out and said, well, there's no evidence for reduced mortality with more exercise. Physical exercise added to standard of care might improve fatigue and depression. but there's inconclusive evidence for benefits to quality of life, physical function, anxiety, or serious adverse events. But there's limitations to this Cochrane review, and the main one really is that of the 1,892 participants in the 18 trials that they reviewed, there was only 3.7% of the population had CLL. And even though CLL is the most common leukemia, this was really surprising. And in fact, most of the trials involved ALL, AML, and multiple myeloma, so really acute leukemias and lymphomas. And 8 of the trials involved stem cell transplant. So it was almost the curative stage. And so what we can take away from the Cochrane review is that, yes, there might not be any evidence for reduced mortality, but it's in a very specific population of heme malignancies. And as you all know, heme malignancies is a very heterogeneous population. And so we need to be looking more into this. And we really need to be looking more into the individual disease groups and the individual people that we recruit into these studies. So quite clearly, there isn't enough evidence for physical activity or nutrition to benefit CLL. And so everything that we say today is just us trying to figure out what these benefits actually might be, so that eventually we can come along and start prescribing exercise and diet that is going to benefit you in the long run as a CLL patient. So I asked the question a few years ago, well, what CLL mechanisms might we be able to change? I know fine well that we're not going to be able to change the cytogenetics, but there has to be ones that we can change if we're going to put people with CLL through these interventions. And so one thing that we know is that the metabolic phenotype of CLL is quite different. And we know that CLL cells prefer lipids as an energy source. And that's because lipoprotein lipase, or LPL, is aberrantly expressed in CLL cells. And as such, higher LPL is a prognostic indicator of worsening disease. And the increased LPL allows the uptake of lipoproteins where they can be stored and converted into free fatty acids. So, of course, their glucose and glutamine pathways are still working and can contribute to more fatty acid production from the extra acetyl-CoA pool. But we know that exercise and diet can actually affect these metabolic pathways at a cellular level. But in the case of CLL, we don't know if it would be as simple as, say, reducing the amount of saturated fats or changing what you eat. That might not be the case, because there are other pathways for energy still working. It could well be that you could make it worse, but unlikely. But we have to get the evidence before we can start making these recommendations. And then another one that I'm really interested in is the potential to modify cell-to-cell communication. And 2 major ways that CLL cells use this for their advantage are by secreting an abundance of regulatory proteins or cytokines and the continuous secretion of extracellular vesicles. And what's really interesting is when you exercise, your skeletal muscle and your heart and your immune cells also secrete these compounds. And at that point, the balance between the CLL communication and the healthy tissue communication is altered. But does it alter the balance for a benefit? And so that's what we wanted to find out. And so actually just this year, we published our first paper looking at the physiological fitness of treatment-naive CLL population. And this figure on the bottom here is a CLL-like cell line, so in vitro. And we've taken serum from patients who are moderately fit versus patients who are moderately unfit, and actually really quite unfit. And although the error bars and although the differences aren't huge or astounding, what we see is that the fitter population blunts the growth of this CLL cell. And so that would indicate that there's something in their serum that is stopping the CLL cells from growing as fast as what they normally would do. And so we measured some of that. And forgive me, these are quite complicated, but this top figure here is the difference between the high fit and the low fit for these extracellular vesicles, which we know can affect tumorigenesis. And on the bottom is the same idea, but this one is for lipids and lipoproteins. And so you can quite clearly see that there's differences between fit and unfit people with CLL and their biological components that are just circulating around the blood. So from that, we designed a pilot study to see if we could actually exercise patients with CLL, because there was really nothing, there was nothing out there. Nobody had done an exercise study specifically in CLL. And so we needed to see whether it was going to work, if there was something there that we could use and something that we could promote. And so we recruited 16 adults with treatment naive, again, watch and wait CLL before COVID hit. And we put 10 of them through 12 weeks of high intensity interval training, or HIT, with the other 6 serving as a control group. And for those of you who might be balking at the idea of doing HIT was really just walking at a little bit of a faster pace and maybe up a little bit of an incline. It wasn't, I wasn't asking anybody to run really fast around the track or sprint up and down the gym. This was really just all walking based. And so we also included some resistance work, because we wanted to see if we could improve muscular endurance and cardiorespiratory endurance, and see if we could improve their overall fitness. And so, like I said, this was the first exercise intervention specifically designed for CLL patients and to assess some of the biological effects. So I'm going to show you some of the effects that we saw. So the first one that every exercise scientist out there asks is, well, did it make people fitter? And as this was a pilot study, and we're using this data to generate for new grants, we presented it with these values at the top. These are called effect sizes. And so 0.2, 0.5, and 0.8 represent a small, medium, and a large effect. So anything over 0.8 would usually indicate something is pretty different, pretty significant. There's a large effect for whatever the group is. On the left, we've got the control people, and on the right, we've got the high-intensity interval training. And what you can see is there's not really much of a difference for aerobic fitness. And in our previous HIT studies that we've done in all these other different disease groups, we usually see a change of about 15 to 25%. But in this group of CLL, we only saw about 5%. And that was quite intriguing. And we think we've got an idea of what's going on there. And we're going to take some of our research down that path at some point in the future. But what about their strength? And strength is such an important component to overall health, because it helps prevent falls and so on. And so what you can see here is that muscle strength increased a huge amount following the high intensity interval training. So although the cardiorespiratory fitness wasn't working as well, the ability to generate strength and power and become stronger changed much, much better. And so we were quite pleased by that. And the participants who took part in the study were equally as pleased as well, walking around with their 6-packs and so on. But as an immunologist, I'm really interested in what your immune system is doing. And so there are cells in there called your natural killer cells, and your natural killer cells recognize and kill tumor cells, including CLL tumor cells. But they become dysfunctional over a period of time very quickly when you have any kind of cancer. And so what I did was we actually isolated out these NK cells, and we isolated out tumor cells, and we incubated them in vitro in the lab to see if the NK cells following the exercise training would kill tumor cells. And so this one here is a tumor cell line. So these aren't real tumor cells, but they're very close. But this one would indicate a secondary cancer that many CLL people would have an increased risk of developing. And as you can see, after 12 weeks of exercise training, we have this large effect for the NK cells' ability to kill them. And then we have a CLL cell line that was similar to the other figure. And again, we have a large effect showing that we can kill them better. And then we took out their own tumor cells. And sure enough, we see that your NK cells can recognize your own tumor cells, because we've probably damaged the tumor cells. And now your NK cells are killing more of the tumor cells, which was fantastic for us. So what's going on? Well, we know that CLL causes a metabolic imbalance. And we know that energy has been redirected from healthy tissues to CLL cells. And we think that exercise and diet can rebalance this metabolism. And this is just a graphic that we created a couple of years ago that would suggest that as you're on this path of health and you get diagnosed with CLL, everything rapidly declines. Your fitness, your immune function, everything rapidly declines compared to normal in the green line. And what we think we can do with exercise and dietary guidance is we can bring it back closer to this line of healthy aging. But we have to figure out how to do that, and we have to do research to be able to show that that's actually what happens. And so I'm going to talk to you about a couple of studies that we're going to open next year. This is the first one. This is the most intensive one. We're calling this one Energize CLL, and this one will be 3 groups, 12 weeks long, supervised exercise training in the gym with us, nutritional guidance for a week, or a combination of both of them. And what we're really looking for is changes in physical health and risk factors for poor health, and changes in cell and tissue metabolism to confirm what we think is actually going on. And we'll do the majority of testing before and after the 12 weeks, and then we'll have a 6-month follow-up. And this will be open to people with CLL and potentially their partner, if your partner is suitable, or your caregiver, or your friend if you want one. And we'll take everybody in to have a look. But you're going to have to live close to Guildford to be able to do that one. If you don't live close to Guildford, then you could potentially do this one. This one's going to be all about remote exercise nutritional guidance. To get into this one, we'd like you to still be able to come in to Surrey just for a quick visit, and then everything else will be online, virtual, remotely completed. The same groups, the same populations, but just less traveling and less intensive face-to-face for people who want to take part in that. And of course, if you can't do that one, then we have this whole virtual idea, because we have to be able to generalizable, and we have to make sure that our exercise programs and our nutrition programs can go out into the population. And so this one will be pretty much exactly the same, except it'll all be virtual. Everything will be done online, over the phone or over Skype or some kind of Zoom protocol. So that's 3 studies that we're going to open next year. We're going to hold a focus group at some point very soon, just to make sure that we're all on the same page, and advice that you think would be pertinent to our design is given to us, because we don't want to open a trial and it's not any use to you at all. So what can you do just now? Well, to keep informed about our studies, we should hopefully be opening them in 2022. So you can email me just now, or you can email CLL support, and we'll keep you updated with when they're opening. We obviously have to go through ethics and approval and get everything sorted. But if you want to start exercising more now, or you want to start eating better now, then go onto the NHS website. There's a lot of information there about diet and exercise. But our recommendation would be contact your GP, because you have a chronic condition. There's a lot of things that are going on there that really could do with you getting tested before you actually start doing some sort of exercise. This is a RPE chart. This is a perceived exertion. The lower the number, the easier it is. 1 to 4 is generally okay for everyone to do. Anything above 4 would require some sort of clinical testing, just to make sure that your heart's healthy, your muscles are healthy. It's not going to cause you long-term damage. And something I would ask of you is to start regularly recording your physical activity levels and diet, because the more information we can have coming into a world of big data, the better we'll be able to say what kind of things are influencing the long-term prognosis of CLL. And with that, I just want to thank the CLL support group for inviting me to talk here, and thanks to everyone for listening in. And hopefully we can have a great chat afterwards.
Thank you, David.